Doctors say it's just aging. But what if the real reason your throat keeps bothering you after 60 has nothing to do with age at all? In the next 25 minutes, I'm going to walk you through exactly why this happens, and at the end, I'll share the one simple remedy that doctors quietly recommend more than almost anything else, and most people never hear about it until years too late. If you're over 50, I want you to think about something for a second. How many times in the last month have you cleared your throat without even thinking about it? How many times have you woken up with that dry, scratchy feeling or noticed your voice sounding a little different than it used to, a little rougher, a little weaker by the end of the day? Most people just shrug it off. They say, well, I'm getting older, this is just what happens now. And honestly, that's what a lot of us have been told our whole lives, that as we age, our throat, our voice, our swallowing, it all just naturally gets worse, and there's nothing much to do about it. But here's the thing, that's only half the story. Yes, your body changes as you get older, but a huge number of these throat issues, the constant mucus, the irritation, the cough that won't go away, the feeling like something is stuck, these aren't just aging. They're signals, and once you understand what's actually causing them, a lot of it becomes manageable, sometimes even completely. So today, we're going to go step by step through what's really happening in your throat after 60, why it happens, what the warning signs mean, and yes, eventually, I'll get to that one remedy that so many doctors rely on personally, but rarely bring up during a quick appointment. Stick with me, because by the end of this video, you're going to understand your own throat better than most people ever do. Let's start with the basics, because understanding why makes everything else make so much more sense. Your throat isn't just one simple tube, it's actually a busy intersection. It's part of your breathing system, your digestive system, and your voice all at once. And like any part of the body that gets used constantly, day after day, year after year, it goes through changes over time. As we get older, the muscles in our throat, the ones that help us swallow and that control our vocal cords, naturally lose a little bit of strength and flexibility, similar to how muscles in our arms or legs do. At the same time, the tissue lining the throat becomes thinner and produces less natural lubrication than it used to. Now here's something most people don't realize. This thinner, drier tissue is much more sensitive to irritation. Things that never used to bother you, certain foods, dry air, even talking for long periods, can suddenly start causing discomfort. On top of that, many people over 60 are dealing with other factors that quietly affect the throat. Things like acid reflux becoming more common with age, certain medications that cause dry mouth as a side effect, and simply not drinking as much water throughout the day as we used to. Put all of this together and you've got a throat that's more sensitive, less lubricated, and more reactive than it was 20 years ago, and that's before we even talk about the specific symptoms. So let's go through them one by one. Let's talk about mucus, because if you're someone who finds themselves clearing their throat constantly, sometimes without even realizing you're doing it, you are absolutely not alone. This is one of the most common complaints among people over 60, and it's also one of the most misunderstood. A lot of people assume excess mucus means they have some kind of infection or that something is wrong with their lungs. But in many cases, it's actually related to something called postnasal drip, which is when mucus from your nose and sinuses drips down the back of your throat. And as we age, our body's mucus tends to become thicker and stickier, partly due to changes in hydration and partly due to certain medications. Here's something interesting. Your throat doesn't like that thick mucus sitting there, so it tries to clear it, which causes that constant throat clearing habit. But here's the irritating part. Every time you clear your throat forcefully, it actually causes tiny bits of irritation to the tissue, which can make your throat produce even more mucus in response. It becomes this frustrating cycle. Mucus causes clearing, clearing causes irritation, irritation causes more mucus. I'll come back to this cycle a little later because understanding it is actually a huge part of the solution. Now let's talk about that lingering cough, the kind that isn't from a cold, doesn't seem to go away with cough drops, and just sort of lives in the background of your day. This is incredibly common in people over 60, and there are actually several different things that can cause it. One major cause is something called silent reflux. Most people think of acid reflux as heartburn, that burning feeling in your chest. But silent reflux is different. It happens when small amounts of stomach acid travel up into the throat without causing that classic burning sensation. Instead, it just irritates the throat tissue, causing a chronic cough, a feeling of a lump in the throat, or that need to constantly clear your throat we just talked about. Here's a fact that surprises a lot of people. Silent reflux becomes significantly more common as we age, partly because the muscle that's supposed to keep stomach acid down doesn't work as efficiently as it used to. Another major cause of chronic throat irritation is simply dry air, especially during winter months when indoor heating strips moisture from the air. And for a lot of people, it's actually a combination: dry air plus mild reflux plus thinner throat tissue all working together to create that nagging, "Why won't this just go away?" cough. This next one is important, so I want you to really pay attention here. Difficulty swallowing, sometimes called feeling like food gets stuck, or needing to drink water with every bite, becomes more common as we get older, and a lot of people just quietly adjust their eating habits without ever mentioning it to anyone. They start cutting food into smaller pieces, avoiding certain foods, eating more slowly, and they figure, well, this is just how eating is now. Here's why this happens biologically. Swallowing is actually a surprisingly complex process. It involves dozens of muscles and nerves working together in a precise sequence, all happening in about 1 second, every time you swallow. As we age, these muscles can weaken slightly, and the coordination between them can become a little less smooth. For most people, this shows up as mild, occasional difficulty, nothing dramatic. But here's the part I really want you to hear. If swallowing difficulties are frequent, getting worse over time, or happening with liquids as well as solids, that's something that should be mentioned to a doctor, not because it's necessarily serious, but because it's the kind of symptom that's much easier to address early than later. I know this video is about home remedies and things you can do yourself, and we'll absolutely get there, but I'd genuinely be doing you a disservice if I didn't mention this clearly. Have you noticed your voice sounding a little different than it used to? Maybe a bit rougher, a bit weaker by the end of the day, or it takes more effort to project, especially if you're talking on the phone or in a noisy room. This is incredibly common, and there's actually a name for it. Some doctors call it presbyphonia, which is just a fancy way of saying age-related voice changes. Your vocal cords are made of delicate tissue and tiny muscles, and just like other muscles in your body, they can lose some strength and elasticity over time. The tissue can also become drier, similar to what we talked about with the throat lining. Here's something that I think is actually really encouraging though. Research has shown that, much like other muscles, the muscles involved in your voice can respond to use and exercise. Some speech therapists specifically work with older adults on vocal exercises, and many people notice real improvement. So if your voice is changed, that doesn't mean it's permanent or that nothing can be done. It often just means those muscles and tissues need a little extra support, which, conveniently, ties into a lot of what we're about to talk about. So let's step back for a second and connect all these dots, because I think this is where things really start to click. Mucus, irritation, coughing, swallowing changes, voice changes. On the surface, these seem like separate, unrelated issues. But notice the common threads running through almost all of them. Thinner and drier throat tissue, reduced natural lubrication, increased sensitivity to irritation, and in many cases, some level of acid reflux making things worse, often without the classic heartburn symptoms people expect. This is actually really important because it means that instead of trying to find 5 different solutions for 5 different symptoms, there are actually some core things you can do that support your throat across the board, and that's exactly where we're headed next. I'm going to walk you through 5 supporting remedies, things that genuinely help with hydration, irritation, and that frustrating mucus cycle. And then, after that, I'll share the one remedy that ties everything together, the one that doctors quietly rely on more than almost anything else for long-term throat comfort. So don't go anywhere, because what's coming next might be simpler than you expect, but more effective than you'd think. The first supporting remedy is something so simple it almost sounds too obvious: staying properly hydrated. But here's why this matters so much more after 60. Our sense of thirst actually becomes less sharp as we age, which means many people are walking around mildly dehydrated without ever feeling thirsty enough to notice. And remember everything we talked about: thinner tissue, less lubrication, thicker mucus. Dehydration makes every single one of those worse. When your body doesn't have enough water, the mucus in your throat becomes thicker and stickier, which means more throat clearing, more irritation, and that frustrating cycle we talked about earlier gets even worse. The fix isn't complicated, it's about drinking water consistently throughout the day, not just when you feel thirsty. Some people find it helpful to keep a water bottle visible on their desk, by their favorite chair, somewhere they'll see it regularly. It sounds almost too simple to matter, but for a lot of people, this one change alone noticeably reduces that constant throat clearing within just a week or two. The second remedy is about the air around you, specifically humidity. If you live somewhere with dry winters, or if you use indoor heating regularly, the air in your home might be drier than you realize. Dry air pulls moisture from your throat and nasal passages, which again leads to that thicker mucus and that scratchy, irritated feeling, especially first thing in the morning. A simple humidifier in your bedroom can make a surprisingly big difference. Many people who struggle with that dry, scratchy throat feeling every morning find that adding moisture to the air overnight noticeably reduces it. You don't need anything fancy or expensive. Even a basic humidifier running while you sleep can help your throat tissue stay more comfortable and less irritated. The third remedy is one that's been around for generations, and honestly, there's a reason it's stuck around so long. Warm, saltwater gargles. This is something many doctors still recommend today, not as some old wives' tale, but because it genuinely helps. Gargling with warm salt water can help soothe irritated throat tissue, and it can also help loosen and clear some of that thick mucus we've been talking about. The way it works is fairly simple. The salt water helps reduce swelling in the throat tissue temporarily, and it helps thin out mucus, making it easier for your body to clear naturally, rather than that forceful throat clearing that causes more irritation. A simple routine. Warm water with a small amount of salt gargled for about 30 seconds, once or twice a day, especially in the morning, can become a small habit with a noticeably soothing effect over time. The fourth remedy combines two things that work really well together: honey and warm liquids. Warm liquids, things like warm water, herbal tea, or warm broth, can help soothe an irritated throat almost immediately. The warmth itself has a calming effect on irritated tissue, and honey has actually been studied for its soothing properties on the throat. It has a thick coating texture that can help ease irritation and may help calm that nagging cough we talked about earlier. A lot of people find that having a warm drink with a spoonful of honey in the evening, especially before bed, helps reduce nighttime coughing and that dry, scratchy feeling in the morning. It's gentle, it's simple, and for many people, it becomes a comforting part of their evening routine, one that happens to genuinely support their throat at the same time. The fifth remedy is one that doesn't get talked about nearly enough, and it has to do with how we eat, not just what we eat. Remember when we talked about swallowing becoming more complex as we age? Two things can make a real difference here: eating more slowly, with smaller bites, and sitting upright while eating and for a while afterward. Eating slowly gives your throat muscles more time to coordinate properly with each swallow, reducing that stuck feeling some people experience. And staying upright rather than reclining right after a meal helps prevent stomach acid from traveling back up into the throat, which, as we discussed, is one of the hidden causes of chronic irritation and that lingering cough. These aren't dramatic changes, but for a lot of people, simply slowing down at meals and staying upright for 30 minutes or so afterward makes a real, noticeable difference in how their throat feels for the rest of the day. So now, let's bring this all together, because here's something interesting. If you look at everything we've talked about: hydration, humidity, soothing irritation, reducing reflux, supporting your throat tissue, there's actually one simple habit that touches almost all of these at once, and it's the one that many doctors quietly recommend to their own patients, often without much fanfare because it's just so simple it almost gets overlooked. And that remedy is this: a consistent daily routine of warm water with honey, paired with proper hydration throughout the day. I know after all that buildup, it might sound almost too simple, but here's why it works so well together. The warm water soothes and hydrates irritated tissue immediately. The honey adds that soothing coating effect that can calm irritation and reduce coughing. And when this becomes a consistent daily habit, rather than something you only do when your throat already feels bad, it helps keep that tissue more consistently hydrated and less reactive in the first place, which means fewer flare-ups of that mucus cycle, less irritation, and over time, many people notice their voice feels less strained too. The reason this doesn't get talked about more is exactly because it's not flashy. There's no special product to sell, no complicated routine, just a simple, consistent habit. But consistency is exactly what makes it effective. This is the kind of thing that doctors often mention almost in passing during an appointment. By the way, try having some warm water with honey regularly, and patients sometimes don't realize just how much that simple suggestion can help over time. So here's what we've covered today. Your throat changes as you age, that's natural. But a lot of the symptoms that get blamed on just getting older, the mucus, the throat clearing, the cough, the voice changes, often have specific, understandable causes. Things like dehydration, dry air, reduced lubrication, and silent reflux. And the good news is, a lot of this responds well to simple, consistent habits. Staying hydrated throughout the day, adding humidity to your home, warm salt water gargles, warm liquids with honey, and eating a little more slowly and upright. And if you bring these together into one consistent daily routine, especially that warm water and honey habit, many people notice meaningful improvement, often within just a few weeks. And remember what we talked about earlier, if you're experiencing frequent swallowing difficulties, especially if they're getting worse or happening with liquids, that's worth mentioning to your doctor. Not out of fear, but because catching things early always makes a difference. Your throat has been working for you your entire life, helping you speak, eat, laugh, and connect with the people you love, often without you ever giving it a second thought. And the truth is, it doesn't take a complicated routine to support it, just a little consistency and understanding what it actually needs. If this video helped you understand your own body a little better, do me a favor and hit that subscribe button because there's so much more we can cover together. In our next video, we're going to talk about something just as important: simple daily habits that can help protect your hearing as you age, and a few warning signs that are often overlooked. And if you know someone, a parent, a spouse, a friend who's been dealing with that constant throat clearing or that nagging cough, share this video with them. It might be exactly the explanation they've been looking for. Take care of yourself, and I'll see you in the next one.